you, Madam Chair, members of the Council. Really appreciate the opportunity to speak with you today, give you a bit of an update and peek into what I believe coming in the future. So first, let me thank each of you for the work you have been doing to really support and encourage our community to take really drastic measures seriously and protect our neighbors, our families, and indeed our whole community and county. You have heard, I'm sure, with both our briefings as well as what's been in the media, that our community mitigation strategies and our physical distancing work have been making a big difference. In the last week or so, I've watched, not only have we bent the curve, we have flattened the curve, which has been extremely encouraging for a first step. And in the last 2 days, I've actually seen with our data what looks like it might be the first step to decreasing some of the infections. It's too early to say. I won't feel confident telling you that what I'm seeing is going to pan out any further. But we know that our community mitigation strategies are effective, and I think the whole country has been paying attention. But I don't want anybody to take these findings as an indication to relax our strategies. The threat of a rebound, or what's often called a second wave, is real, and it can overwhelm the healthcare system and more, and that will remain for the foreseeable future. So what we've seen in the healthcare system is a continued capacity, both in their intensive care units and in their regular hospital beds. I want to credit the hospital system here. They've really modeled for the nation coming together and doing fairly drastic measures that are economically challenging for them by delaying surgeries, by stopping whole lines of business in their clinics, by going telephonically. So they have indeed set the stage so that if a surge had happened, that it would not have been as overwhelming as in other areas of the country that weren't prepared. So I really wanted to give a shout out to that system. I do want to go over with you some of the criteria that is now emerging from the models to be the key indicators to know when we can begin to think about how to transition and how to look at the community mitigation strategies over time. But let me say, and I know Councilmember Dunn has been a student of the 1918 influenza pandemic, but let me just read from our blog for the whole council on this. During that influenza pandemic, the health officer at the time and the mayor of Seattle put some pretty strong social distancing measures in place, and the city actually fared much better than other cities at the beginning. But when victory was declared in World War I and people emerged out of their homes in celebration, and then all the closures and prohibitions and mass gatherings ended, shortly thereafter there was a serious second wave of illness that lasted for several months. And it's a sobering lesson about the danger of prematurely relaxing our community mitigation strategies. So preview I want to talk to the council about is what are the criteria we're looking for to even begin that conversation. The fact that we really do believe it cannot be a light switch, that we're going to have to carefully work together on how to begin reopening the economy, and at the same time it will be the responsibility of your health department to watch very closely and give you feedback along the way. And this is what we're talking with the governor about. So the criteria are this. First, how many people are getting sick from COVID. So we need to see a steady decrease in the number of people getting sick and needing hospitalization for at least 2 weeks, 2 weeks decline before we should even think about any changes. So as I said, right now we're experiencing a flattening and a glimmer, a hint that we may be seeing a decrease, but I want to be honest with the Council that we have not seen a decrease as of yet. Secondly, health system readiness. This is one that I think that our hospital systems, as I said, have been doing a great job. We need to make sure as they think about what sort of services they're going to be doing, that they need our support to continue to have enough capacity so that we don't risk anything when we have a second wave. We will have a second wave, folks. It's just a matter of how bad the wave is. The third criteria is about testing. We really need widespread testing, ability to keep COVID-19 cases at a manageable level. It requires widespread availability of rapid testing and reporting of results. And as we all know, testing is not that broadly available. It's been a problem at the federal level. We've had many partners step up to help us. We just got 20,000 new test kits this week that we're sent out to our partners, but we need a much bigger influx of that to make it really widespread available. Testing is necessary to have the most accurate picture of the extent and spread of the outbreak to inform public health strategies. The fourth criteria is what I'll call public health readiness. The consensus is that public health agencies will need a level of capacity to do large number of case contact investigations in order to identify people who are infected and their close contacts, to quickly help with isolation and quarantine when we have a pop-up of an outbreak, so it can contain it and it doesn't spread to other areas of the community, and give the assistance to those that are in isolation and quarantine to be successful. We're now starting to do some work on what that ramp-up would need to be. We had to stop this level of contact tracing in the first couple of weeks of the outbreak, which seems like forever ago. We just didn't have the capacity, and we needed to focus on larger scale measures that we knew would help. So my staff will be working on that and looking at numbers, and we're also starting a pilot to take a look at unique ways of doing this through the use of some volunteers, through the use of telephonic work, which can have an equity and social justice issue. So we're wanting to make sure we're not disadvantaging any part of the community by our strategies. So all that is going to be intense work over the next few weeks. And then the last criteria is really the emergence of proven treatments and also a vaccine. The vaccine is going to be a ways off. They're working hard, but I don't see it emerging quickly. And proven treatments, they're really working hard on this. We may see something in the next few months. So with that, I'll just say that with the support of the community, one of the things we're really critically aware of is that we all need to consider the hardship that a prolonged set of stay-at-home has on folks. It is hard on all folks, whether or not they have families at home, are isolated alone, the mental health issues that arise from prolonged isolation for all of us, but particularly for folks, seniors and our elders, is of grave concern. And there are indicators that public health will be watching around that, and indeed looking at how we make sure we attend to those needs while we're going through this, because that's the only way we can be successful, because people will start stepping aside of these mitigation measures if they are not continually reminded that they need to do this to protect themselves, their families, and indeed the community. So the last thing I'll say, and then I want to talk about an opportunity with the State Board of Health, is that just yesterday I got there's great modeling going on all over the place, and one part of the University of Washington sent me some information on some modeling they were trying to look at, and it showed that if we relax these community mitigation strategies, the social and physical distancing too quickly, that the bounce back was more than doubling the outbreak so far in a very quick time. So this modeling really cautioned us about moving too fast too quickly. Whereas if we did a more slow roll of how we think about things and we do it in a way that is mindful of all these different components, that we do get a second wave, but it's much more minimal. It does exceed where our first wave was. So that's the range that I, as the head of public health, are looking at. Dr. Duchin, trying to keep you informed. Madam Chair, did you want to talk about the State Board of Health letter or do questions first?
Why don't you go ahead and talk about the State Board of Health letter, and then we'll wrap up with questions. Thank you.
Yes. So the State Board of Health has the rules in place that require what type of reporting has happened for notifiable conditions. Notifiable conditions are regular things that I talked to you about, like tuberculosis and hepatitis A. COVID-19 is now a notifiable condition. The State Board of Health has their rule open, and we have the opportunity to comment to them, to ask them to please require race and ethnicity be part of the requirements for what is reported to public health. Right now, we've been really struggling with getting accurate data out on race and ethnicity, and it's the majority of the reason why is because we don't have this reporting and we don't have broad interviews of folks directly. So with those two things, up to 50% of our statistics are not including race and ethnicity. So it's been a real struggle and disappointment to Public Health Seattle-King County in trying to really look at the pandemic and its implications here. And so we've drafted a letter that can be co-signed by the council, by the chair of the Board of Health, and the county executive. So with that, I'll turn that over for some comments from you, Madam Chair.
Yeah, thank you. Thank you, Patty. And thank you for your update and for everything that your team is doing. It's such a long ways from the last time we had a briefing when things were trending downward and looking really bleak. And even today to have the news in the newspaper about the doctor from Evergreen that is now recovered and doing better. I mean, just everything is, yes, it's wonderful news and it's working. And I think the key message we all need to echo constantly is, but it only keeps working if we keep at it, or else we could go right back to those times when things were looking very bleak very quickly. On this issue of the letter, colleagues, Director Hayes asked if I would sign this on behalf of the council. Unless I hear any objections, I'm happy to do that because I think we're keenly aware of the health disparities by race in our county. Virtually every indicator you look at will point to racial disparities, and not having the information doesn't mean that there's no racial disparity in this COVID-19 outbreak. What it means is we don't know about it, and if we don't know about it, then we can't respond to it, and we can't respond to the challenges that are happening in our community disproportionately to communities of color, especially. So, and that applies to all the notifiable conditions that we were talking about. So I'm happy to sign on to this letter, and I'll give Councilmember McDermott, Board of Health Chair McDermott, a moment to say a word if he wants to. Then we're going to have to hoard our remaining precious moments for questions from the other members. So, Board Member McDermott, Councilmember McDermott.
Thank you, Madam Chair. I'll just be really brief. Thank you for drafting the letter. I'm pleased to co-sign it. And for me, it's not only about making sure we know how COVID-19 is affecting people of color, people who are historically marginalized, but recognizing that such people are historically marginalized. This is yet one more way it shows up, and we need to be engaged and attentive to that. With that, Madam Chair, I'll leave it to questions from colleagues.
Thank you. Okay, colleagues, same drill as last meeting. If you would introduce yourself by saying your name, then I'll call on you by name.
Lambert.
Councilmember Lambert, please go ahead.
Thank you. I've looked at the data from Pierce County and Snohomish County, and their deaths are far less than ours. What do we attribute that to, and what adjustments are we making knowing that that's happening?
So thanks for that question. I haven't talked to those other two public health directors. I think one of the reasons why King County is experiencing what it has, as I look across the country, is that our outbreak began within long-term care facilities. Unlike Chicago and Kansas City, where it's happening in neighborhoods, where you have a diverse age range of folks, ours hit in the most vulnerable population. And then we saw that workers in long-term care, as well as others who go between long-term care facilities, it spread between the long-term care facilities. So we were hit in the most vulnerable area first, and I think that you'll see as the data plays out that as we are working with all long-term care facilities, right now we had an infection control specialist who is with us that is meeting with every long-term care facility that is not at a case in order to beef up their infection control. We've also worked with DSHS to get better reporting from the long-term care facilities. One of the issues you probably saw with Life Care is that they did not report to public health nor the state when we're having a series of pneumonia outbreak when the virus was just emerging. So the timing of when these long-term care facilities notify us, the ability for them to have infection control procedures in place, the assistance from the state to actually get, so if they have sick staff members, that those staff members don't work. All those things were in the learning environment here in King County that actually is being used nationwide.
Thank you.
Colwell.
Councilmember Colwell, please go ahead.
Thank you, Madam Chair. Patty, I really appreciate the dashboard that is available to us from Public Health. I'm wondering about why we're going to receive the reports only on Monday, Wednesdays, and Fridays instead of daily. Is it because of staff time constraints or what?
So luckily the dashboard on our website will be updated daily, so you can always go there. What we're doing with the media is our blast out of report, and that's the report you're talking about, is going to 3 times a week just because of the overwhelming amount of work that we have. That was one thing that we can keep it updated for you on the website, so feel free to go every day on the website. I would recommend you go around 3:30 in the afternoon. That's the best time to see the most updated. And we will be improving those dashboards over time as we continue the work.
Thank you, Patty, and thank you for all you and all of Public Health are doing.
Zahala.
Councilmember Zahala, please go ahead.
Thank you, Madam Chair. First of all, Director Hayes, it's hard to even summon the words needed to show you the gratitude you deserve. You're not only a local hero, but a national hero for setting the precedent for how to flatten the curve and save lives. Thank you so much to you and your whole team. Really can't show you enough gratitude. Is there any plan for mobile testing sites to, for example, visit communities that have that don't have healthcare access or don't have access to the resources they need to be tested in general? Is that needed? Could you just talk on mobile testing?
Yes, and thank you for that, because the dream would be, as we get more testing, to really look at how we use, say, our mobile medical van or our other resources, or work with local fire departments to increase testing around the county where people have difficulty getting to their provider. We have supplied the community health centers with some of the small amount of test kits we have received, because we know that those are important places in the service area for our community, particularly in the south end and in the north. So we are looking at all strategies. I hope for the day we have enough testing kits to do that, and I hope it won't be in the far distant future. We have some drive-up test sites that have been used by first responders and for healthcare workers who need to be tested. Those are going to be our model to expand so that we can get testing out. And we hope that all providers will find a way to really can do more and more testing over time. So we want to use all those strategies.
Thank you.
We've gone a little bit over time. Is there a final question for Director Hayes? I will ask Councilmember Lambert. I'm going to wait for somebody who hasn't had an opportunity, if that's all right.
Sure, mine's quick.
Dembowski.
Councilmember Dembowski.
Thank you, and Patty, thanks for your incredible work right now. I echo Councilmember Zahalai. On the data that you indicated in your opening presentation was showing a decline in infection in the last couple of days. There was some reporting a few days ago about a delay, at least on a statewide basis, in collecting and releasing the data. Could you talk a little bit about how close to real time the data that the Public Health Department is releasing is, and any other kind of things we should be watching as we look at the numbers?
Yeah, that's a great question. When you look at our numbers, I think you need to keep in mind a couple of things. When we get the test results, just recall that testing could have occurred a couple of days or maybe a little bit longer. So the numbers you see aren't really reflective of the day before, but the few days before. So think about it that way. And then the state system has had just a terrible time handling the just amount of information coming into it. So the state no longer gives us any data on the negative tests. So one of the frustrations from the team is we can't give you a denominator any longer. That will be fixed in the next few weeks. Microsoft deployed a team down to the state to help them. And then what we also know is the state can get backed up, and they have trouble with some of the tests not having identifiers. So I think the reference point that you're making is when there was over 1,000 positive tests that the state could not identify the county, and they had to do some scrambling to figure out from the lab where to put those positive tests. So that meant that the labs here in the county who had sent those tests in were credited to being King County residents, and then it will fall upon us working with the state to figure out if it really was a Snohomish County resident that got the test and what just happened to be sent to a King County lab, and we're still sorting that out. But we're fairly confident now in our numbers that you see to reflect and we're continuing to work. I don't think the state had large a backlog anymore, but it has been a frustrating thing.
Thank you so much.
Okay, we have once again over the time you generously offered us to be with us. I've got a couple questions that we will collect, and we'll collect any others and send them to you separately for follow-up later. One of them is whether we can have data by city. Another one is about long-term care facilities. But we're going to let you go now and respect your valuable time. Thank you so much for being with us today, Patty, and for everything that you and your team are doing. Please send our tremendous regard and support to your whole team. You're doing an amazing job keeping us all safe.
Thank you so much. Thank you.